2021 Restraints Education. Let's look into our policy on restraints. Restraints. What is considered as a restraint? Restraint is any method, chemical, physical or mechanical device, material or equipment that immobilizes or restricts a patient's freedom of movement. Our goal is to become restraint-free organization. However, in certain situations, the benefits of use may outweigh the risk. All patients have the right to be free from restraint of any form and have the right to receive care in a safe setting. In order to protect the right of patients, the use of restraints is limited to those situations for which there is adequate and appropriate clinical justification. Restraints may only be used to protect the patient's well-being and support medical healing. Restraints may be used in accordance with safe and appropriate restraining techniques and ended at the earliest possible time. Restraints may be initiated only after less restrictive measures or other alternatives are failed or determined ineffective. What are some of the alternatives to avoid restraints? Here is a list of alternatives that can be used to avoid restraints. Are you familiar with these ones listed here? Reorientation, de-escalation, distraction, sitters, family, hourly rounding, etc. This might help to keep patients safe. You may have to try at least a couple of these alternatives and fail before you call for restraints order. Here is a picture of the activity apron used for distraction or for keeping the patient busy. This activity apron is available in our stores and the order number is listed on the slide. Ordering of restraints. Restraint order must be obtained from a physician, a MD or a DO before application of restraints except in emergency. In case of an emergency, a RN may initiate restraint and obtain a verbal or telephone order during or immediately after application. Use of standing orders or PRN orders are prohibited. Restraints need to be discontinued when the need for it is no longer present. We cannot discontinue the restraint and then restart it under the same order. For restraints, there are two different order sets and two restraint policies. One is non-violent restraints for confused patients, and the other one is violent behavioral restraints for violent patients or psych patients. Let's look into the first policy, non-violent restraints, PC064. The non-violent restraints is used for confused patients to keep them safe. The initial order is valid for 24 hours and subsequent renewals issued once per calendar day. A face-to-face evaluation should be done by the physician within 24 hours. Patient has to be seen at least once before renewing the order. Visual observation and reassessment has to be completed every 2 hours and documented in patient chart every 2 hours. Documentation for nonviolent restraints. For nonviolent restraint order, every 2-hourly documentation has to be completed. The documentation should consist of the following, such as skin integrity, circulation, position change, range of motion, hygiene, etc. Use of restraints require a modification to the patient's plan of care and should be reviewed and updated every 24 hours. So we need to initiate a plan of care on restraints and document it every shift. It is also very important to notify the patient's family or designee the reason for restraint and also document it. The second policy is the violent behavioral restraint PC 142. Violent behavioral restraint is used to protect the individual against injury to self or others. This type of restraint may be applied only in an emergency on violent patients. An order must be obtained prior to use or within minutes of application. Original order for violent behavioral restraint is limited to 4 hours for adults 18 or older. It can be renewed for maximum of 24 consecutive hours and must never be returned as needed or PRN order. A physician or a licensed independent practitioner must do a face-to-face evaluation within 1 hour of initiation of violent restraint. Continuous visual observation of the patient is required and reassessment needs to be conducted frequently. Visual observation, reassessment, and documentation for violent behavioral restraint patient is every 15 minutes. Now let's look into the types of restraints we use here at Methodist. The first one is the universal limb restraint. It is applied on the wrist or on the ankle. It is the most common one, and we can restrain the patient on more than one limb at a time. The second one is the mitten. These are bulky mittens like boxing gloves, and these are considered restraints and require an order. The third one is the posy vest, which is the least common one, and we try not to use it because of risk of strangulation or choking. If we are using it, you need to increase patient monitoring and watch for safety. Always use quick release knot or slip knot to secure the restraint. Restraints have to be tied only to a non-movable part of the bed, so bed frame will be the best place to tie it. The restraint must be the least restrictive intervention that will be effective to protect the patient, a staff member, or others from harm. This should be used for the least amount of time as possible. Let's look into a restraints application again. Always use quick release or slip knot to secure the restraints, and it has to be tied onto the bed frame or a chair frame. A trial release is not allowed as it would be considered a PRN use of restraint. If restraints are discontinued prior to the expiration of the original order, a new order is needed to restart restraints. If the nurse releases the restraint while she is in the room for the purpose of patient care, it is not considered a discontinuation of the restraint and can be reapplied without a new order. But if the nurse releases the restraint and leaves the room, a new order is to be obtained. Remember, restraints have to be immediately released in emergency situations such as code blue, before CPR, any time impending patient injury, or fire evacuation. When we put patients on restraints, we are doing it for their safety. But while they are on restraint, it's our responsibility to keep them safe and not to get hurt from the restraint. Next is reporting of death. We need to report or notify the risk management for any death that occurs while a patient is in restraints, or any death that occurs 24 hours after discontinuation of the restraint. Risk management team needs to report these cases to the state for investigation. So we have to be very careful and monitor the patient when patients are on restraint and restraint shouldn't be the cause for any death. Okay, let's summarize. Again, a reminder, documentation, documentation, documentation is very important for restraints. Restraints documentation has to be completed on a timely manner. Do not wait until end of the shift to chart. Restraint orders expire at certain time, so get the orders renewed before it expires. We need a valid restraint order and your documentation needs to match the order. Non-violent restraints need documentation every 2 hourly. Violent restraints need documentation every 15 minutes. Now, if you still have any questions, please review the restraint policy. Thank you.